What is going on, gangers? Brother Namdi back at your service, and I'm here to dive into a continuing series where we look at fictional characters and what health conditions they may have. If you'd like to stay caught up with this series, please make sure you subscribe to my channel. For part 38 of this series, we are going to dive into a fictional character that people may or may not know, and his name is Tanjiro from Demonslayer. I decided to use syncope to describe Tanjiro's condition. Let's first dive into what syncope actually is. Syncope is a medical term for temporary loss of consciousness, but most people know it as fainting. It happens when the brain doesn't get enough blood flow for a short period of time. Causes could include the following: vasovagal syncope, which is generally a harmless form of fainting caused by temporary sudden drop of heart rate or blood pressure, and this can be triggered by stress, pain, fear, or prolonged standing. Another cause could be orthostatic hypotension, which is a sudden drop in blood pressure when standing up. Other factors such as cardiac issues, dehydration/low blood sugar, or even neurological reasons could cause syncope. What does syncope look like, guys? It's usually a sudden fainting or passing out that's usually brief from seconds to a few minutes, and full recovery would happen after. Warning signs such as signs and symptoms to look out for would be dizziness or lightheadedness, blurred vision or tunnel vision, nausea, sweating, or feeling weak or warm. Most cases are benign, but recurrent or unexplained syncope, especially during exercise, can signal a serious heart condition, so that should be evaluated at once. So I'm sure y'all wonder, how does this correlate to Tanjiro from Demonslayer? Let me tell you right now. Tanjiro often suffers from severe blood loss. Acute blood loss lowers blood pressure and reduces oxygen to the brain. This is a classic cause of syncope. Then you often see him collapsing mid-battle and struggling to stay conscious after injuries. Tanjiro is also seen in high-intensity sword fighting, sprinting, and breathing techniques that push his body past normal limits. Tanjiro uses total concentration breathing, which involves controlled hyperventilation and breath holding. Prolonged use or improper use can lead to low CO2 levels and lightheadedness and fainting. Due to the long missions Tanjiro goes through, he suffers from dehydration and electrolyte imbalance due to minimal food or water, excessive sweating, and prolonged travel. This also contributes to orthostatic hypotension because it's prone to making him collapse when standing or moving suddenly. Tanjiro has also seen some of his allies die. Remember when Rengoku died? Intense pain and emotional stress or trauma can cause syncope, guys. And lastly, this brother is always getting some head trauma. He's even trying to headbutt people himself. That is a direct cause of syncope. Constant blows to the head. But how can we diagnose syncope, guys? This is kind of simple, I'm not gonna lie to you. If it's a doctor, they would ask medical history questions. What happened before, during, and after the fainting? What are their triggers? What are the warning signs? The duration of the fainting? Are they on any type of medication or family history of heart disease? We would closely look at their vitals as well. Listen to their lungs and heart. We could also run some labs like an EKG to check their heart rhythm and blood tests like glucose, electrolytes, and hemoglobin. But always check out the red flags of syncope, guys. This would include syncope during exertion, chest pain or palpitations, or family history of sudden cardiac death. How do we treat syncope? For immediate cases, we would do the following. Lay the person flat and elevate their legs. This will improve blood flow to the brain. Please loosen tight clothing, check their airway, breathing, and circulation. If they are semi-conscious, you'll give them fluids. But it really depends on what is actually going on in the body currently. For dehydration, you would probably give like Pedialyte or Gatorade to replenish the electrolytes. For orthostatic hypotension, you would slowly change their position from sitting to standing. Don't do it fast because that's how they'll faint. In Tanjiro's case, I believe laying him flat and elevating his legs along with oral hydration, such as Pedialyte and Gatorade again, would help him immensely. As always, if you have any of these conditions, please seek help because at the end of the day, you matter. Fictional characters were used to give a different perspective in a situation. If you appreciate this video, please like, comment, and subscribe. If you haven't already, please check out the previous 37 parts to this series. If you have a suggestion for part 39, drop it in the comments. And if nothing else, y'all take it easy.